In this week's video, we're going to give you an update about my knee surgery because about once a week we get a request about what's happened with you, what's happened with your knee. So we're just going to take a quick moment and give you an update about my knee.
Yay.
So if you recall, you can watch our video up here, but if you recall, I've had ongoing knee problems my whole life. My right knee was just deteriorating. When we were in England, when we first launched, I stepped off a curb and it popped. And from there, it was just downhill. So we did a bunch of research and we thought about where I could get some knee surgery. I was told a couple times that in Mexico, I was told, and in Europe, I was told that the hyaluronic acid and cortisone shots that I was getting were not going to work anymore, and I need to get a more permanent solution. So that sent us on a trail to research about where I could get knee surgery.
Yeah, and so I'm going to be asking her some questions so that I can be involved in this video in a little bit, and maybe interjecting a little bit here and there in my perspective. But
who are we?
We are Chris and Steve, Eat, Walk, Learn. We are full-time travelers. We've been traveling the globe since May of 2021.
Right. We sold our house in Denver, packed everything up, what was left of it, which was the only things that fit in our carry-on suitcase, sold our car, sold our house, and we've been on the road ever since.
That's right.
Anyway,
that's right.
Yeah.
Yeah. So you talked a little bit about your, what they did, that the hyaluronic acid, cortisone shots, or whatever. But what was the diagnosis? What did they tell you had that need to be fixed?
Right. So after all the research, we got to Kuala Lumpur, Malaysia. And I saw 3 orthopedic surgeons there and got 3 different opinions. The consistency in the opinions was my meniscus was all a mess. I had no cartilage left at all in my knee. I was bone on bone in my knee, and I had all kinds of damage behind my patella, behind my kneecap. And so
this was just the right knee.
My right knee. And basically it was just a meat grinder without any meat in it. So I originally thought I was going to need an entire full knee replacement. And at the time I was 55 at the surgery, 56 a couple days after the surgery. And all the doctors were really hesitant to fully replace my knee because...
Yeah, they don't really like to do it when you're that young, because how long did they say a knee replacement lasts?
Yeah, like 10 to 15 years. So they didn't want to see me at age 70 and getting a new knee. So they were really reluctant. On the other hand, I needed to do something. So the doctor I decided to use, and all of his information's in the description and also in the video, was a doctor at the Pantai hospital in Kuala Lumpur, Malaysia. He had something different to say. He wanted to do arthroscopic surgery and do stem cell replacement. And this seemed like, after lots of research, and we actually went to the lab and looked at the stem cell results at the lab and all the efficacy from the donor on my stem cells and so on, I felt confident that this was the right decision for me. So
yeah, and from my perspective too, it seemed like not a perfect solution, because there really isn't a perfect solution, because again, a new knee would only last 10 or 15 years. What did they tell you how long the stem cell, if you had a perfect recovery from the stem cell treatment, how long that would last? Yeah,
they said 5 to 10 years. There's really not a lot of longevity on this type of surgery results. So he said 5 years, maybe 10 years. It could be longer, but a good 5 years. And I thought, well, if I could at least buy myself 5 years without having to get a full knee replacement, that might be the right solution for me. Yeah. And the reason why we went to Malaysia is because I looked at these options in the US, and even with insurance, and even if I could find a doctor, number one, there's no stem cell replacement therapy for knees yet in the US. There is some stem cell stuff, but not for knees. And no knee doctors would replace my knee in the US. And even if I could find somebody and my insurance did cover it, it would still cost probably about $25,000 out of pocket, also with PT and everything all combined with insurance. I'm sorry, $25,000 with insurance in the US. And I thought, there's got to be a better way. So we'll cut to the chase. It was $10,000 total for everything I'm going to tell you that I did in Malaysia. And that's also in this video here you can watch about.
Yeah. So when exactly was this? Because
I had surgery in December of 2022. And then I had, so in the surgery, it was orthoscopic surgery. He went and cleaned up everything and then gave me my first injection of stem cells, which was the infrastructure stem cells. Those are the stem cells they install to create scaffolding in my knee. And then in January, they went and I got an injection of my actual stem cells that went into the infrastructure cells.
Yeah.
So it's about a year later.
And I remember that period very well. I remember us getting an Airbnb and making sure that there was not going to be any stairs that you need to step up or step down in order to get into our apartment. And also, you didn't have to like step into a bathtub or anything like that. Like
right.
Everything was, could be very easy for you. But so during that time and since that time, like what's the pain threshold?
Yeah, that's a good question. And by the way, you did a good job on the Airbnb. So thank you for taking care of me for doing that. So, and when you got the Airbnb, we were thinking I was going to have a full knee replacement. And so the bendability and mobility was going to be less. Anyway, after the surgery, I was very mobile. For probably a week or so, I was on pain meds and sore, but not really in pain, just kind of awkward learning how to get some mobility back in my knee. Then I started PT. And then in January, when I got the stem cells injected, that was probably the most painful day of it all. The actual injection of the stem cells and then my body reacting to, oh my God, there's all this weird stuff in it. My body was just like, pain. But pain meds took care of that. And then I really have not had any pain to speak of that. I mean, maybe an aspirin might have been necessary or some ibuprofen or something every once in a while. But in general, there's been no pain.
Yeah. And I've been, when you have had pain or some discomfort, I certainly am the one that hears about it first. And, we travel full time. And so this we're talking about 14 months ago that you had this surgery done. And it feels like there have been some times, but recently, you didn't seem like any symptoms, from 10 years ago, because you had a lot of pain before you had the operation because your knee needed to be replaced, and so there was that bone on bone. There was certainly a lot of pain there and a lot of discomfort there. Yeah,
I guess there's been pain, but not at all like what I had before the surgery. So I guess I kind of, in my memory, I'm having some pain, but it's not anything I'm really remembering or having to react to. Like sometimes in bed at night, on my stomach, when I'm laying on my stomach and my leg is fully extended, I might have a little pain then at night sleeping, or it's more discomfort than it is pain. But it's always, whatever it is, it's always better than what it was before.
And you've had a few different instances where you used physical therapy, and that's one of those. Is we said, I can't. They still have some swelling. I can't get my leg completely straight. I need to get some PT. Right. Kind of walk through what that.
Yeah. So I had some PT in Kuala Lumpur right after the surgery.
Okay, champ. Physical therapy time.
So we were in Kuala Lumpur for a month after the surgery. Had PT at the local hospital, and then they gave me some exercises to do at home alone and in a pool, which I did. And then I kind of didn't do any PT for a while. Shame on me. And then when we got back to the States, so this was like 6 months later, right? I found a PT guy and physical therapy guy in Seattle, and he came to my house a couple times. And he showed me some really complicated exercises that I found just super difficult to do.
You're exercising?
And because they were difficult, I had a tough time doing them. And so I wasn't a really good PT patient. And so then I just kind of decided that I actually called my doctor. We did a virtual call and I explained what was going on. And he said, basically because I was a little bit frustrated with my mobility and my range of motion. And he said, basically, you're right on track and you're healing. So I think my expectations were a little bit high for my timeline on my overall healing and mobility. So after that conversation with him, I realized that I was right on track and that I needed to just kind of focus myself on doing lunges and getting up to doing squats and continuing with the hiking and the walking that we're doing. And then I think we're going to in a minute talk about where I am now, but I just kind of had to a little bit own as you always do, you have to own your responsibility to your healing and then really kind of listen to my body on what I need to do rather than have the PT guys they were telling me what to do, but it wasn't really working for me. And so I kind of rebalanced in my head, like, all right, this is what I want to do. These are my goals. I looked a little bit on Facebook about some exercises to do, and then kind of figured out what was working for me and did my own thing.
Yeah. And I think it's interesting because you essentially have, all your parts.
What part of my part is your part?
That you originally had. I mean, compared to a knee replacement where they literally, cut the bone and put in, artificial,
right.
Parts in you, and then you need to recover from that bone being, replaced with parts. But the parts are artificial in
right.
your knee socket. In this case, it's like a regrowth of the cartilage
right.
in your knee.
Yeah, I regrew the cartilage.
It takes time.
Right, exactly. So so it took about I think, I haven't had any MRIs. It would be interesting to get an MRI now. But it basically took a year for all that cartilage to regrow and for my knee to figure out how to work again with the new parts and the new shapes and so on, because he reshaped my femur and he reshaped my tibia. So everything was a new shape and so on. And so then the cartilage had to grow in. So the whole thing kind of had to figure out how to mesh together and be its knee on its own.
Yeah. So let's we talked about how, we're full-time travelers, but like, what is our day-to-day, what's our lifestyle look like for somebody with after knee surgery?
Yeah. So, we've always been big walkers. So even before surgery, we were walking about 10 to 15,000 steps a day. And after surgery, of course, that slowed down a little bit. But we still, even to this day, we do 10 to 15,000 steps a day. So that's a normal every day. I think we both have 11, 12,000 step goals or something every day that we do every day. And a lot of places that's really easy in our lifestyle if we're downtown or we have to walk to the market or we don't have a car or a bus. We're hitting those numbers easy. Sometimes it takes us a little effort in order to get those numbers in. And then we also do a lot of hiking. We play pickleball, we work out, we exercise, we ride bikes. And so I actually do more now than what I did before I had my knee surgery, just because my knee doesn't hurt anymore.
Yeah, even just today, we've already put in about 10,000 steps, and it's still, in the middle of the day.
Yeah.
But we also went for a long bike ride.
Right.
And part of that was playing disc golf, which is where you're using your muscles and using your body, and you get in an even different way than just walking.
Yeah. So we're pretty active.
Yeah. And I think that you've been doing great. Any regrets? Anything that you'd like to see different?
Back in April, so I had the stem cells in January, and then in April, we went on that big hike in Japan. We went into the Kodo Kimono, or Kimono Kodo, which you can see the video here, which is a big, major, very difficult hike that we did in Japan that, was straight up and straight down. And I had poles, or one pole, and my ego was like, oh, we can do this. I have a brand new knee, no problem. Let's go do it. But the truth was I had a ton of atrophy, which I didn't expect from the surgery causes atrophy. And then, of course, not using the leg caused atrophy too. So I had a ton of atrophy and I kind of overlooked it. And when we were on the trail, I was not good. And it was raining and it was miserable conditions. So all that together, I was not a good trail mate. It was not my best day.
Yeah.
And you were so good. You were so nice.
But, she says that she wasn't good, but it was hard for me. And she was like, I need to take a break. I don't think I could do anymore. And I'm like, oh, thank you. This was a hard hike.
Yeah. And honestly, I should not have done that hike. When I think about other hikes I've done with other friends in Denver and stuff, and I had people that would come along that were on the hike that really should not have been on the hike. And we all, we always accommodate for people and everybody's always welcome. But I would think there's some people in my mind that I thought, you shouldn't have come with us. You shouldn't have been on this hike. And I was that person when we were in Japan. So anyway, so that was in April. Since then, we are absolutely back into hiking. And so then I also did a series of exercises I would get on YouTube and do aerobic exercises and strength building exercises, just body weight strength building exercises on YouTube, just to get my fitness back. And my fitness certainly had dropped. It was dropping from the original knee pain, and then not being able to, anyway, we were always fit, but my fitness was definitely worse than what it has been. So with the help of some videos on YouTube, I was able to get my fitness back. And then I feel like I'm finally back, like a year late, it's 13, 14 months later, I feel like I'm truly back and healed because I'm now working out again at F45, which for me is like my litmus test. If I can do an F45 workout, I'm in pretty good shape. Granted, I'm not doing as good as I used to do. My weights are less and stuff, but I'll get there.
Yeah. If you haven't done F45, it's a high intensity workout. It's 45 minutes of just pretty much like one thing to the next with like 10-second intervals of rest with
it's a tough
in between. It's a tough workout, and when you're done, you feel it, and it sounds like success.
Yeah, and the fact that I can do it, I mean, I have some goals at F45 to get the weights up and get the repetitions up and my speed up, but I'm back. I feel like I'm back. So for those of you who are thinking about knee surgery or your choices with knee pain, we're not doctors. We're not going to recommend anything for you. You certainly have to go through your own avenue for where you want to go. But for me and for us, 14 months after my original orthoscopic surgery in Kuala Lumpur, and then 13 months after my stem cell injections, I absolutely feel like my knee is maybe 90%. My right knee is maybe 90% of my left knee. My right knee is never going to be as good as my left knee because it's not my natural knee. I don't think. We'll see. But I definitely feel like I've got a knee that's going to carry me for a good 4 or 5 years. We'll find out. Obviously, we'll let you know. But for all of you who've been asking, best decision ever. I would do it again in a heartbeat. I would recommend my doctor again. I would recommend the procedure I had again. And I absolutely have no regrets. How about you?
No regrets. That's my middle name.
If you have any questions, write them below. We're glad to answer any. Thank you for following. Thank you for asking and worrying about my healthcare or asking about my healthcare. I mean, we're full believers in medical care around the world. We've had lots of positive experiences. We're going to show a video here of other medical care that we've had in case you're thinking about getting your teeth fixed or getting your feet fixed. We've done those too. So we'll talk to you later.